We have talked about the cortical and subcortical regions of the brain as well as the spinal cord, and now we are going to focus on the brainstem. Here we have an image of the brainstem from the ventral view, and in this view you can really get a nice picture of the cranial nerves. So you should notice that cranial nerve 1 is very closely associated with the cerebrum, whereas cranial nerves 2, 3, and 4 are associated with the medulla. Some of it is hidden here from view. Cranial nerves 5 through 8 are located at the level of the pons, you can see there, whereas cranial nerves 9 through 12 are at the level of the medulla, around there. You should also notice that cranial nerves 3, 5, and 8 are located medially, while the other nerves are located laterally. And all of the cranial nerves exit ventrally except for one. And do you know which one that is? Cranial nerve 4. It exits dorsally and then wraps around to join the rest of the nerves. Now let's turn the brainstem around and look at it from the dorsal view. You can note that there is midbrain consisting of the midline pineal body, which you can see there, and the superior and inferior colliculi. Superior and inferior. The superior colliculi mediate vision, while the inferior colliculi mediate hearing. Vision and hearing. And do you remember the nuclei of the thalamus that's also important for vision, and there's one that's also important for hearing? And there's a little mnemonic for those, right? The LGN, lateral geniculate nucleus, right? That's also associated with vision, and the MGN is associated with hearing. Just a quick review. Now we spoke about the pineal body and its role in the circadian rhythm and sleep initiation. Do you remember what important hormone it secretes to execute this function? Melatonin is the hormone secreted by the pineal body, and it is important for sleep induction. Parinaud syndrome is seen with lesions that compress the dorsal midbrain, such as pinealomas and hydrocephalus. The symptoms include impairment of vertical gaze, and you get this because of impairment of the superior colliculi. You will also see large irregular pupils, ptosis, and impaired convergence. As you saw in this diagram from the previous slide, cranial nerves exit the brainstem from certain points, and obviously they have to come from somewhere before exiting the brainstem. Cranial nerves have their origins in various brainstem nuclei. The midbrain is the source of cranial nerve 3 and 4. You can see examples of that there. The pons is where the nuclei from 5 through 8 lie. Lastly, the medulla hosts cranial nerve 9 through 12. A rough way of also understanding this is that all the medial nuclei are motor. That's a mnemonic that can help you remember where these different nuclei exist. It could be useful in a question where you're given information about a lesion that occurs maybe more medially or more laterally, then you have a set of answers that deal with different functions. If it's a medial lesion, then it's more likely that the deficit that you should see would be a motor deficit rather than a sensory deficit. Now there are many holes in the skull called fossa or foramina that the cranial nerves and other structures pass through to exit the skull. So we're going to go through these from anterior to posterior. Most anterior is the cribriform plate. This isn't a single opening, but rather a meshwork of many tiny holes that cranial nerve 1 passes through. Remember, cranial nerve 1 is for the sensation of smell, and so it lies above the nasal cavity. It's actually in the ethmoid bone. Now next, on the sphenoid bone, we have the optic canal. And this is where cranial nerve 2, as well as its associated arteries, the ophthalmic artery and the central retinal vein, pass through. Lateral to that, we have the superior orbital fissure. And there we have cranial nerves 3, 4, V1, and 6. And you should recognize something about all of these different nerves, and I'll get to that in a second. In addition to these nerves, through the superior orbital fissure, you also get the ophthalmic vein as well as sympathetic fibers. Now it makes sense that this is the orbital fissure, right? Orbital meaning the orbit or where the eye is. And you have cranial nerves 3, 4, 6, and the first division of the trigeminal nerve. All of these are important, of course, for different functions of the eye, mostly motor movement. And so it makes sense that they all travel together out of this foramen. Cranial nerve V2 passes through the foramen rotundum, which is round, rotund, round, and cranial nerve 3 passes through the foramen ovale, which is more oval shaped. You should note that cranial nerve V1, V2, and V3 pass through the skull in numerical order 1, 2, and 3 from anterior to posterior. One mnemonic that we suggest is that divisions of cranial nerve 5 exit owing to standing room only, right? And you can go standing room only. So superior orbital fissure, then rotundum, then ovale. The last foramen in the sphenoid bone is the foramen spinosum. This is actually not for cranial nerves, but the middle meningeal artery passes through here, so you should definitely know about it. Another mnemonic that may help you is ROS for these three foramina. ROS, which usually stands for review of systems, but rotundum, ovale, and spinosum. The posterior cranial fossa pass through the temporal bone or the occipital bone. In the temporal bone, we have the internal auditory meatus. Cranial nerves 7 and 8 pass through here. The jugular foramen is at the border of the temporal and occipital bones, and cranial nerves 9, 10, and 11 pass through here. The hypoglossal canal is the small hole in the occipital bone which cranial nerve 12 passes through. And last, but far from least, is the foramen magnum, which is the exit point for the brainstem, the vertebral arteries, and the spinal roots of cranial nerve 11. The cranial nerves are very commonly tested, so if you don't know them already, you need to spend some time memorizing the chart in your book and really knowing them. Every time you do a physical exam during third year, you're going to be testing the cranial nerves over and over again, so you might as well learn them now. As you know, there are 12 cranial nerves. Luckily, all of them are pretty straightforward, and you can figure out the function from the name of the nerve. For instance, the optic nerve mediates sight, and the olfactory nerve mediates smell. This is obvious, right? The ocular motor nerve mediates 4 of the 6 extraocular muscles. What are the other 2 cranial nerves mediating extraocular muscles? Well, one is the trochlear, which mediates the superior oblique muscle, and then you have the abducens, which mediates the lateral rectus muscle. Cranial nerve 3 also has a parasympathetic component, which mediates pupil dilation, accommodation, and the production of aqueous humor. It also sends fibers to a small muscle called the levator palpebrae, which opens the eyelid. The trigeminal nerve, cranial nerve 5, primarily mediates sensation of the face. The only motor component of cranial nerve 5 is the muscles of mastication, and that simply means chewing. The facial nerve, cranial nerve 7, controls the muscles of the face except for the muscles of mastication, which is controlled by, as we mentioned, cranial nerve 5. Cranial nerve 7 also is important for lacrimation, and that's something that might not be as intuitive, and you should definitely remember that. The cranial nerve also mediates secretions from all of the salivary glands except for the parotid gland. Which nerve mediates the parotid gland? That would be cranial nerve 9, glossopharyngeal. The facial also mediates taste from the anterior 2/3 of the tongue through the chorda tympani. Which nerve mediates taste from the posterior 1/3? Cranial nerve 9. Now let's talk about the 8th cranial nerve, the vestibulocochlear nerve. It's not written in here, so I'll write that out. This goes from the ear to the brain, so of course it mediates the 2 functions of the inner ear, which are hearing and balance. The glossopharyngeal nerve, cranial nerve 9, we've already started to discuss in conjunction with cranial nerve 7. The major functions, as we mentioned, include taste from the posterior 1/3 of the tongue and control of secretions from the parotid gland. The vagus nerve is one you definitely want to know about. It is a major nerve. It controls the majority of the parasympathetic nerve that innervates visceral organs, all the way down to the splenic flexure. It also mediates taste from the epiglottis region, mediates swallowing, and palate elevation. The accessory nerve, cranial nerve 11, is a pure motor nerve, and it mediates the sternocleidomastoid as well as the trapezius. Lastly, the hypoglossal nerve is also a pure motor nerve, and it mediates the muscles of the tongue. There is a nice mnemonic to help you remember which cranial nerves carry sensory, motor, or both types of information. It is, some say marry money, but my brother says big brains, butts or breasts matter more. I guess it depends on what kind of guy your brother is. You can choose which one of these B's is best suited to describe your brother and to help you remember it. Okay, let's talk about the vagus nerve in more detail. Remember, this is a really major nerve. It mediates the connection between the brain and the body, or at least some of that connection. It has three major functions. It has a motor component to the pharyngeal muscles for swallowing and the voice box for speech. It also has a parasympathetic component, and it mediates sensation in certain areas. And each function has a separate nucleus that encodes information. The nucleus of the solitary tract obtains visceral sensory information and is responsible for mediating appetite and taste. Cranial nerves 7, 9, and 10 all synapse here. The nucleus ambiguous, see there, is the origin of cranial nerves 9, 10, as well as 11, and it mediates motor production of swallowing, palate elevation, as well as speech. Lastly, the dorsal motor nucleus is the parasympathetic nucleus to the heart, lungs, and digestive tract. And this information actually travels all the way down the digestive tract to the splenic flexure, which is near the end. It's in the colon. Okay, it is time for a flash quiz. Which nerves are responsible for innervating taste from which portion of the tongue? This is a good one, and it's one that you should definitely remember. The facial nerve mediates taste from the anterior 2/3 of the tongue through the chorda tympani, right? That's cranial nerve 7. Whereas the glossopharyngeal nerve, cranial nerve 9, mediates taste from the posterior 1/3 of the tongue.